Now, after completing the muscles of your arm, both anterior and posterior compartment, the muscles of your forearm, anterior and posterior compartment, and along with that, we have even completed a very conceptually anatomical snuff box along with the extensor retinaculum. After completing all these topics, let us now move towards the muscles of hand, sir. As we have actually planned, we are going to learn all the muscles first, then we'll actually go towards the nerves, guys. Now, let us move towards the muscles of hand. Muscles of hand, nowadays, it is one of the most important topic for any exam that you are going to attempt, whether it is INI set or NEET PG exam or FMG exam, whatever exam you are going to write down, muscles of hand is almost every time important, guys. So let us discuss about all the muscles of hand in detail, all their names, their nerve supply, their actions, and especially in the recent exam, they have asked about the attachments of the muscle. So let us even learn about the attachments also, guys. Now, first of all, how many muscles do you have in the hand? There'll be like totally 20 muscles in the hand, guys. So, muscles of hand, remember, there are like totally 20 muscles in the hand, sir. 20. And all those 20 muscles of the hand, they'll be supplied by ulnar nerve and median nerve. I hope you know that. All the muscles of the hand will be supplied by ulnar nerve and median nerve. Now, out of these 20 muscles of the hand, remember, there'll be 4 thenar muscles. There'll be 4 thenar muscles. And then there will be 4 hypothenar muscles. There'll be 4 hypothenar muscles. And then you'll be having 4 lumbricals. There'll be 4 lumbricals. And then there will be 4 interossei. That will be palmar interossei. From the name itself, you can understand, guys. Interossei. Inter in between, osseous means bone. And then there will be 4 dorsal interossei. So there will be 4 palmar interossei, and then there will be 4 dorsal interossei. So there will be like 4 thenar muscles and then 4 hypothenar muscles, and then you'll be having 4 lumbricals, 4 palmar interossei, and 4 dorsal interossei, guys. Now, out of all these 20 muscles, let us first of all concentrate in detail about the thenar and hypothenar muscles first, guys. Let us discuss in detail about the thenar and hypothenar muscles, guys. Now, I'll tell you a small trick here, how to remember the names of these muscles, how to learn the name of these muscles and all, guys. Follow my method here, sir. First of all, take up your right hand like this. Try to learn it practically, guys. Take up your right hand like this. I'll make you write down the notes also. Like first, try to understand here. First of all, this group of muscles that is present below the thumb, this will be thenar group of muscle. And then there will be another group of muscles over here, and that will be actually your hypothenar muscles below the little finger. Fine. So this is thenar and this is hypothenar. First thing. Second thing to learn here, whatever muscles that you have in the thenar group here, in their name you'll be having pollicis brevis. In their name you'll be actually having what, sir? Pollicis brevis. Pollicis means thumb and brevis means short. Obviously here we are actually learning about the muscles of hand, and they cannot be long muscles. That is actually shorter one, brevis. Is it okay? So thenar group of muscles, in their name will be having pollicis brevis. And whatever hypothenar group of muscles that you have here, in their name you will be having digiti minimi. Okay, little finger, minimi, digit, finger. So I want you all to first of all remember these 2 points here. Okay, this group of muscles will be thenar group of muscles, and this will be hypothenar. And this will be actually the pollicis brevis in their name, and they will be having digiti minimi in their name, guys. First you learn these points. Now after learning these points here, let us actually learn the actions done by the thumb, sir. Okay, what are the actions of thumb? For example, if I move my thumb along like this here, sir, along this plane, I want all of you, whoever is listening to my video right now, wherever you are, just do it practically along with me, guys. Okay, that will help you a lot. Okay, so if you are moving the thumb like this here, guys, that is nothing but flexion, and this will be extension. So flexion of the thumb, extension of the thumb. Now if this is like flexion and extension, then how will be the adduction and abduction? To understand that, do one thing here, change the plane like this, sir, in this manner, and now move the thumb up perpendicularly away from the fingers. Repeat again, move the thumb perpendicularly away from the fingers. I mean to say in this plane. Understanding? So now if you're moving the thumb away from the fingers, that is abduction, and move the thumb towards the finger, that is adduction. Hope it is clear now. So let us do it everything in one plane here, guys. This is flexion, this is extension, and this one here will be abduction, and this is adduction here. And not only this, not only the flexion, extension and all this, guys, you can even count with your thumb also, guys. Okay, so counting with your thumb like this, so it's like opposition. So finger is trying to come closer, we are opposing it. Finger is trying to come closer, opposing it. So that is nothing but opposition, guys. Okay, so with the thumb you're able to do flexion and then extension, then abduction, adduction, and then opposition, guys. Now you might be thinking, okay, why is sir actually telling about all these actions right now? It makes sense. Whatever actions of thumb are done here, all these actions are done with the help of the muscles present over here only. Understanding? So keeping all this information in our mind right now, let us make the name of this muscle, sir. I'm telling you not to mug up, sir. Make the name. I know you have done in first year MBBS like mugging without understanding, guys. So now let us try to make the name of the muscle. So in this diagram, yes, this group of muscles over here, these are actually your thenar group of muscles. Okay, and this group of muscles here below the little finger here, this will be the hypothenar group of muscles. First of all, in the thenar group of muscles, number one, you'll be having a muscle which is helping in flexion of thumb, flexor. And number two, there is a muscle helping in abduction of thumb, that is abductor. And number three, there is a muscle helping in counting, that is opposition, opponents, guys. While writing the names along with me, I request all of you just don't simply copy from the screen here. Try to bring that action in your mind, sir. When you're writing flexor, like this, flexion. Abductor, abduction. Opponents, counting like that. Now, what I tell you in the very beginning of this topic here, what should be there in their name? Thenar group of muscles, in their name, what do you have? You have pollicis brevis. That's the reason why you can just add that along with this one. That's the reason why the name becomes flexor pollicis brevis. Abductor pollicis brevis. And when it comes to opponents, it will be only pollicis, guys. There is a reason for that, I'll tell you. Now, when we are telling flexor pollicis brevis, when we are saying that it is flexor pollicis brevis, somewhere we also have flexor pollicis longus. And try to recall, we have learned in our previous topic, that is in the anterior compartment of the forearm, there was a long muscle, flexor pollicis longus. So if there is a brevis here, the shorter muscle over here, and there is even a longus. Similarly, if there is abductor pollicis brevis here, we have already learned about abductor pollicis longus also. But when it comes to opponents pollicis, we have only and only one muscle. We don't have longus, we don't have brevis there. It's only one muscle for opposition, guys. Understanding? That is the logic behind that. It's not like only simply writing and mugging. Is it okay? If you are observing the names of all those muscles there properly, I'm done with the flexion, I'm done with abduction, I'm done with opposition. What is the only thing left out? Adduction. Okay, so yes, we do have a muscle for adduction here. Number 4, it will be adductor pollicis. Adductor pollicis, guys, for adduction. Now, once you have made the names of the thenar group of muscles, hypothenar group of muscles, it is damn easy, guys. Why? Why I'm telling you it is easy here? Number 1, number 2, number 3, you can just do the copy paste here. So there is a muscle which is flexor, there is a muscle which is abductor, and number 3, there is a muscle which is opponents. And what I said in the beginning of this topic here, what should you add in the name there? Digiti minimi. So therefore, this becomes your flexor digiti minimi. And then this becomes your abductor digiti minimi. And then opponents digiti minimi. Opponents digiti minimi, guys. So thenar muscles and hypothenar muscles made easy. Now there is a number 4th one. 4th one is actually a different one, and that muscle will be palmaris. And will it be like longus or brevis? It cannot be longus at all. We are actually learning the muscles of hand, and these are like intrinsic muscles of the hand. They will be actually shorter in them. They can't be like longer one. So it is palmaris brevis, guys. So I think the thenar and hypothenar muscles are made easy. So first of all, learn the names of this one in a cool and calm and in a crystal clear manner, guys. So we are done with the names of thenar and hypothenar muscles. Now after learning the names, now the next thing is about the nerve supply. I want you all to learn the nerve supply also here only, guys. Here only I want you to learn the nerve supply also. I told you all the 20 muscles of the hand that we are learning here, all these 20 muscles of the hand, they are all supplied by ulnar nerve and the median nerve. They are supplied by ulnar nerve and the median nerve only. Now ulnar nerve is the one which is coming from the medial side here. It makes sense. It should supply to all your hypothenar muscles. Is it okay? And the median nerve is coming from the lateral side, and it makes sense. It will be supplying to your thenar group of muscle. But in that there is an exception. You can see in the notes there, I have written one muscle in the capital letters. In the thenar group of muscle, I wrote there one muscle in the capital letter, and that is adductor pollicis. That is an exception. It will be also supplied by your ulnar nerve, guys. So what is happening here? I'll teach you later on. Don't worry about that. Ulnar nerve, we are going to learn in detail the entire course of that. So ulnar nerve will actually enter here, and after entering, it will be dividing into superficial branch and deep branch. Deep branch will take a turn and go on the other side and supply to adductor pollicis. So therefore, we'll do one thing here. All your hypothenar muscles, all the hypothenar muscles, flexor digiti minimi, abductor digiti minimi, opponens digiti minimi, and the palmaris brevis. And then in the thenar group, that is adductor pollicis. So whichever I have marked here with yellow color, all of them are actually supplied by your ulnar nerves. So ulnar nerve supplies to the hypothenar muscle, and one important exception there is adductor pollicis supplied by ulnar nerve. And whatever thenar group of muscles which are left out here, they are all actually taken care by your median nerves. So the thenar muscles, flexor pollicis brevis, abductor pollicis brevis, and opponens pollicis will be actually supplied by your median nerve. Now previously this used to be tested, guys. This was the one which used to be tested, like what are the names of thenar and hypothenar group of muscles, and then their nerve supply used to be tested, and then exception adductor pollicis used to be tested previously. But nowadays what is happening is they are actually asking you about the attachments of this muscle, and recently they have already asked in the recent exam about the attachment of opponens pollicis, guys. So we'll do one thing here. We'll try to learn the attachments of all these thenar and hypothenar muscles in an easiest manner. So try to follow my technique here, how to learn their attachments, guys. Now to learn the attachment, again the same thing. We'll actually draw that line diagram here, guys, about the bones of your hand, whatever bones you have of the hand you have here, carpal, metacarpal, and the phalanges bones here. So first of all, the carpal bones you'll be having scaphoid, followed by lunate, followed by triquetrum, and then pisiform in the proximal row. And then in the distal row, you'll be having trapezium and then trapezoid. So keep in mind, guys, first you'll be having trapezium, then trapezoid, and then capitate, and then hamate. So proximal row and in the distal row. I hope you all remember very well with the mnemonic, she looks too pretty, try to catch her and all. So that is the same thing. Now after this carpal bones, you'll be having your metacarpal here. Metacarpal number 1, thumb. I'm drawing it little bit abducted. And then metacarpal number 2, index finger, then the middle finger, and then to the ring finger, and finally the little fingers here. Metacarpal number 1, 2, 3, 4, and 5. And then, my dear friends, yes, each and every digit will be actually having 3 phalanges, except for your thumb here. The thumb will be actually having only the 2 phalanges, guys. So this is just a simple diagram, a simplest diagram to understand the attachments. There is a proper logic, if you apply a little bit of logic here, you can easily remember the attachments of all these muscles. I'll tell you, you just follow me here, guys. Now in these attachments, remember first of all, whatever thenar group of muscles that you have, thenar group of muscles that you have, they should be like definitely originating either from the trapezium or from the scaphoid here. They should be actually originating from the trapezium or scaphoid. And whatever hypothenar group of muscles are present over here, they should be definitely originating from the hamate and the pisiform here, guys, on the medial side. Make sense? And one more important thing here is that don't go into the details of it's originating from the tubercle of trapezium, the anterior surface of the hook of the hamate. Never. They will never ask you that thing in the exam. So broadly, if you just remember the common origin here, sir, the trapezium and the scaphoid on the lateral side for thenar, hamate and the pisiform on the medial side for hypothenar. If you remember that, that's more than enough. Originating from here. Is it okay? So don't go into that tubercle and the hook of the hamate and all those. They will never ask you that one. If you know this broadly, laterally, like thenar, you will be having that scaphoid and trapezium, and medially for the hypothenar, you'll be having the hamate and pisiform. That is more than enough, guys. Now, just now I told you about the thenar group of muscles. In the thenar group of muscles, you'll be having your flexor pollicis brevis, abductor pollicis brevis, opponens pollicis, and then you'll be having adductor. Out of that, remember, first of all, there will be one muscle here, which will be originating from here and inserting onto the proximal phalanx. And there'll be one more muscle here originating and inserting onto the proximal phalanx. There are two muscles here. Now you can see here the two muscles originating from the same thing, inserting on the same thing, so proximal phalanx. Then how come those two muscles will be different then? I'll tell you. Again, use the same logic that I told you. In thumb, which muscle will be like more on the outer side? Which muscle is more on the outer side, which has to actually do the abduction? So the muscle which is present more on the outer side here will be actually your abductor pollicis brevis. Abductor pollicis brevis. And the muscle which is just present inside that will be your flexor pollicis brevis. So there will be like abductor pollicis brevis and the flexor pollicis brevis. So even if they give you the image in the exam, whether it is a textbook image or whether it is a cadaveric image, nowadays they are giving the cadaveric image also, easy to find out the muscle which is more on the outer side, abductor. Just inside that will be the flexor. And after that you will be having the next one, that is opponens pollicis, and then adductor pollicis, guys. See, opponens pollicis, actually we have to do opposition. The finger is trying to come here and we have to actually do the opposition here, guys. So do one thing, you also just try to do it like opposition like this here, sir. And try to feel there in that opposition, are you moving only the phalanges of the thumb or are you also moving the metacarpal? For opposition, are you moving only the phalanges? Only the phalanges? No. You also have to move the metacarpal here. So it makes sense, the muscle should actually get inserted onto the metacarpal. So therefore, the opponens pollicis muscle will be actually getting inserted onto the shaft of the metacarpal. The shaft of the metacarpal, you have to be like literally careful with that one. It is actually shaft, that too on the lateral surface. I'm telling it very clearly, that was recently given in the exam. That shaft, that too on which surface? A lateral surface. Why? Because there is another muscle on the medial surface, there is another muscle on the base of that one. So you have to be literally very clear about that one, guys. So what is this muscle here? This muscle here will be your opponens pollicis, guys. Now we are done with the outermost one for abduction, and then you'll be having flexion. For flexion, you'll be having flexor, and then we are done for opposition. Opposition, opponents, I told you how to remember that one. We have to not only move the phalanges, we have to actually move the metacarpals here, guys. Now, if you are done with this one, what is the only muscle which is left out here? That is adductor pollicis. Adductor. Now, again the same thing, apply logic. Don't try to mug up directly from the textbook. Apply logic. This is my thumb. Flexion, extension, abduction, and then I have to do adduction. Adduction, moving closer. If I'm moving closer, then should the muscles will be on the outer side, sir? Adductor pollicis. Will that be muscle on the outer side or towards the inner side? It should be towards the inner side. Makes sense. So adductor pollicis muscle will be towards the inner side, and that too, it has got like two heads. One will be the transverse head, another one is the oblique head, sir. One is the transverse, another one is oblique. Transverse head will be actually originating from here. Okay, and please look at that carefully there. I don't know why during the live classes most of the students will be telling that is second metacarpal. Actually that is the third metacarpal, sir. Okay, so don't forget the first one there, first, second and third. So that is the third metacarpal. It's originated from the third metacarpal. And not only third metacarpal, yes, remember the adductor pollicis oblique head will be originating from the base of second metacarpal, base of the third metacarpal, and as well as the capitate, guys. So let me just draw it like this here. This will be the transverse head of adductor pollicis, and this will be the oblique head of the adductor pollicis. Understanding? So it's originating from where? It's originating from the base of second and the third metacarpal as well as the capitate, guys. There is the oblique head of the adductor pollicis, and that is inserting where? Again the same thing, sir. The proximal phalanx. This one is adductor pollicis. So that is how easy is the attachment of all your Thenar group of muscle, guys. Okay, so just practice that once or twice, it will become easier for you, and you can easily answer, guys. Okay, now out of these two heads, I told you one will be the transverse head. I'm just writing here, this is the transverse head, and this one will be the oblique head. Okay, Now between the transverse head and the oblique head, you'll be able to find one artery coming there, guys. And that artery will be actually your radial artery. That is the radial artery, guys. Okay. So let me just write down here, whatever I have just put a circle there. That's your radial artery. Now again, the same question here. How come radial artery has come there? Again, the same thing. Just now we have discussed. Radial artery will come here and then it will be going back into the enough box, and then here it's coming between the two heads of the adductor pollicis muscle to form the deep palmar arch. Radial artery is going to form the deep palmar arch, guys. Perfectly done. Now in this diagram, let us go towards the hypothenar, and hypothenar as usual, again the same, easier, guys. You'll be having one muscle and then you'll be having one more muscle on the inner side here. So one muscle on the outer side and one muscle on the inner side. And it makes sense again apply the same logic. The outer one here will be the abductor digiti minimi. The one which is just inside that will be the flexor digiti minimi. And then there is one more muscle, but that muscle is going and getting inserted onto this metacarpal. And this one will be the opponents. That is opponents digiti minimi. So abductor digiti minimi, flexor digiti minimi, and opponents digiti minimi. Now what is the only thing which is left out? The one muscle which is different there. Which one, sir? Palmaris. That is palmaris brevis. But remember, palmaris brevis muscle we cannot draw here. Why? Because this is just a subcutaneous muscle. It is actually a subcutaneous muscle, sir, just present below the skin there, guys. So if you just reflect the skin from here, yes, just below the skin you'll be able to find the palmaris brevis. So it will be actually gone once you reflect the skin there. So it will not be seen in the attachments there. That's all. So that will be the attachments of your thenar group of muscles and hypothenar group of muscle. I hope it is crystal clear with this simple diagram here. So just try to practice this diagram once or twice, and obviously it will be easier for you to learn the attachments of this group of muscle. Now going back to our main topic that we started with, we actually started with the muscles of hand, and in the muscles of hand we have actually completed the 4 thenar and 4 hypothenar. Their names, their nerve supply, and the most important for nowadays the trending questions is about the attachments, guys. Done. Now after completing that, we'll go to the next muscles, that is 4 lumbricals, 4 palmar interossei and 4 dorsal interossei. Let us see what are the important points to learn about them. Now look at this diagram, guys. In this diagram you are able to find the 4 lumbricals here, sir. There are 4 lumbricals in this one. Now where are those 4 lumbrical muscles present and how to identify them, I'll tell you here. First of all, in this diagram try to appreciate that there are like 4 tendons here, and these 4 tendons are of FDP muscle, flexor digitorum profundus muscle. So in the anterior compartment of the forearm, you'll be actually having flexor digitorum profundus. There'll be like 4 tendons. The 4 tendons are entering into the hand here. If you observe this diagram more carefully here, you'll be able to see the lumbrical number 1 here. And this is the lumbrical number 2, lumbrical number 3 and lumbrical number 4. Numbering will be always from lateral towards the medial side, guys. So they're like 4 lumbricals. And the first point which I want all of you to remember here is that all the 4 lumbricals are originating from your FDP tendon. They're all originating from your FDP tendon, guys. Okay, you can clearly see the muscles are originating from the tendon of FDP. Now after originating from there, where will the lumbricals go? Where will they go and get inserted? Look at the unique thing, guys. Why is the name given as lumbricals there? You know why? Because lumbrical is nothing but worm-like. So there are like 4 tendons here. The lumbrical is originating from here, and after originating it's going to take a turn and go back. It will be taking a turn and going back, and it will be inserted onto this extensor hood. Now what is that extensor hood here? What will happen? You'll be having a common extensor tendon, and that will be a little bit, flattened. So that flattened common extensor tendon is nothing but extensor hood, or it is also known as dorsal digital expansion. Now why I'm stressing on this point here? Why? Because recently in the exam they have asked about the muscles getting inserted onto this extensor hood. So you have to know which muscles are getting inserted there, guys. Okay, so I repeat again, lumbricals are originating from the FDP tendon, and after originating from the FDP tendon they are going to take a turn and then go back and get inserted onto the extensor hood, guys. So that is the reason why it is kind of a different muscle, guys, a unique one. Why? Because normally in anatomy when you study about the muscles are originating from a bone and they are inserting on a bone. If you study about any muscle, guys, the muscle is originating from a bone and inserting on a bone. But look at this lumbrical. Lumbricals are originating from a tendon and inserting on a tendon, guys. So they are originating from this FDP tendon and inserting onto this extensor hood or dorsal digital expansion. Okay, so let us first of all write down there. So what is the origin of all your lumbricals? They are originating from FDP tendon. And then what about the insertion, guys? It is inserting in extensor hood. Or one more word, remember for that one, dorsal digital expansion. Dorsal digital expansion, guys. Now once you are done with the origin and insertion of these lumbricals, look at the lumbrical number 1, guys. Lumbrical number 1 is originating only and only from one tendon here. Lumbrical number 2, it's also originating only from one tendon. That means L1 and L2, just for the sake of representation, the first and second lumbrical, these two will be unipinnate. These two are unipinnate. And then L3, guys, third lumbrical, it's originating from the two adjacent tendons. And the fourth one is originating from two adjacent tendons here. Okay, so therefore L3 and L4, these two will be actually bipinnate. Is it fine? So the first two lumbricals, L1 and L2, they will be unipinnate, and L3 and L4, these two are actually bipinnate, guys. Now the next thing that you have to learn is actually about the nerve supply. Nerve supply, again easier. I told you all the muscles of hand are supplied by ulnar nerve and median nerve only. So therefore, ulnar nerve is coming from here, medial side, it will be supplying to third and fourth lumbrical. Whereas median nerve will be coming from here, it will be supplying to the first and second lumbrical here, guys. Okay, so therefore, the first and second lumbrical, what is the nerve supply? It will be supplied by median nerve, sir. Whereas the third and fourth lumbrical, these two will be actually supplied. What is the nerve supply? They are supplied by the ulnar nerve. So remember, the first and second lumbrical, we can even call them as, the lateral two lumbricals. First and second one are present on the lateral side, lateral two lumbricals. And the third and fourth lumbrical, we can even call them as medial two lumbricals, sir, because they're on the medial side. Is it okay? So the first and second lumbrical will be lateral two, and the third and fourth lumbrical will be the medial two lumbricals. So they can even use this kind of terminology in the exam. Don't get confused. Okay, now we have studied like 1, 2, 3, 4, and in the exam suddenly it is giving like medial 2 or the lateral 2. Don't get confused with that one. So origin done, insertion done, the nerve supply is also done. Now the last and final thing is, what is the action done by these lumbricals? Now action done by the lumbricals, you can easily remember something like this by the origin and insertion of this one, guys. Look here, lumbricals are worm-like. They're going to begin from here, take a turn and go back. So what they are doing at the metacarpophalangeal joint, when they contract, they will actually flex the metacarpophalangeal joint. And after going back in the extensor hood, they are actually pulling it. So they are extending the interphalangeal joint. So flexion at metacarpophalangeal joint, extension at the interphalangeal joint makes your hand like L shape like this. So the best way to remember L for lumbricals, make your hand like L shape here, guys. Understanding? So L for lumbricals, make your hand like L shape like this. Flexion at metacarpophalangeal joint and extension at interphalangeal joints. So flexion at metacarpophalangeal joint and extension at interphalangeal joint. That makes your hand like L shape, sir. That is about your lumbricals, guys. So all the information regarding the lumbricals done here. So their origin, their insertion, their nerve supply and their action. And I hope you did not forget our topic till now. We are actually discussing about muscles of hand, and in the muscles of hand we are done with 4 thenar, 4 hypothenar and 4 lumbricals are done. Now welcome to the last category, the interossei. Now look at this diagram here. The moment you look at this diagram, you can easily identify in both the diagrams you are able to see the muscles are present between the bones. Between the bones, guys. Between your metacarpal bones. And that is the reason why they are interossei. So in the first diagram here, this one also are interossei. And in the second diagram here, this muscles are also are interossei. But now we have to differentiate between them, like which one is palmar interossei and which one is dorsal interossei. So out of these two, remember, in the very first diagram, they are unipinnate. And the one which are unipinnate are palmar. So palmar interossei muscles are actually unipinnate. And then the one which are bipinnate here, they are dorsal interossei. So dorsal interossei muscles, these are actually the bipinnate ones, guys. Is it okay? So the moment you look at the diagram, you can easily identify, yes sir, they are interossei between the bones, but the one which are unipinnate will be the palmar interossei. The one which are bipinnate, originating from adjacent bones there, adjacent metacarpals there, that is nothing but bipinnate, guys. Now what about the nerve supply? Remember, all your interossei are supplied by ulnar nerve, whether it is palmar or whether it is dorsal, guys. Nerve supply will be always the ulnar nerve only. So all your interossei, the 4 palmar, the 4 dorsal interossei, all of them will be supplied by ulnar nerve only. No doubt about that. Now the last and final thing, the action. What is the action of this interossei? It's very simple. You just got to look at the diagram for a second, guys. If you look at this diagram here, look at the way how it is attached. The palmar interossei, the first one, and the second one, and the third one is attached here, and the fourth one is actually attached here. So now when the muscle is going to contract, what will happen? It is actually going to bring this closer. It is going to bring this closer. And this is actually going to bring this closer and bring this closer here. That means it is going to bring all those fingers closer to the middle finger, guys. So all your fingers are brought closer to the middle finger. What is that known as? It is known as adduction of fingers. So therefore, there is a famous mnemonic for this one. Palmar interossei will be helping in adduction of fingers, pad. Palmar interossei will be helping in adduction of the fingers, pad. Now on the other side, what will be the action of the dorsal interossei? What will be the action of your dorsal interossei? Again, do the same thing, guys. Look at the diagram. Look at the diagram and look at the attachment of the muscle. They are attached in such a way that the dorsal interossei, they are actually going to take all the fingers away like this, guys. That means taking them away is abduction. So therefore, what is the action of dorsal interossei? Dorsal interossei will be actually helping in abduction of the fingers. So pad and dab. Palmar interossei will be helping in adduction of the fingers. Okay, the middle finger being the axis there. Adduction of fingers, and dorsal interossei will be helping in abduction of fingers. Adduction, abduction, adduction, abduction. Understanding? So pad and dab, pad and dab. Fine. We are done with all this information. And now the most important thing which they are asking nowadays in the exam, guys. Apart from all this, nowadays, what is the latest thing that they are asking in the exam here? Look at the attachment of the muscles. And in that attachment, guys, look at that middle finger here. If you look at this middle finger there, can you just tell me, look at that middle finger and tell me, guys, is there any palmar interossei attached to the middle finger? No, absolutely not. Palmar interossei is not attached to the middle finger. So there is no palmar interossei attached to middle finger. But contrary to that, opposite to that, just look at another diagram. In another diagram, yes, in the middle finger, if you observe just the middle finger here, there are 2 dorsal interossei attached here. So one of the dorsal interossei will be attached from here, and another dorsal interossei will be attached from here. So there are like 2 dorsal interossei present on the middle finger. So remember, middle finger doesn't have any palmar interossei, but it is having like 2 dorsal interossei. Then at the same time, look at the thumb. In thumb, you don't have any dorsal interossei attached to that one. Little finger, no dorsal interossei attached. So thumb and the little finger, no dorsal interossei. So let us just make a note of this one. So that's something important, guys, recently asked in the exams. So no palmar interossei. No palmar interossei. On which finger? It's your middle finger. So on the middle finger, there is no palmar interossei attached. But on the other side, yes, there will be 2 dorsal interossei. I'm just writing in short here, dorsal interossei. On which finger? Middle finger. But there will be no dorsal interossei. No dorsal interossei. Another important point. That will be on the thumb and little finger, guys. Thumb and the little finger. So thumb and the little finger, you don't have any dorsal interossei there. You can see the entire thing over here. So that is all the information that you have to remember about the muscles of your hand. So there are totally 20 muscles in the hand, 4 thenar, 4 hypothenar, 4 lumbrical, 4 palmar interossei and 4 dorsal interossei. And we have discussed about all of them in detail. And by this we actually complete what's the muscles of your arm, the muscles of forearm, and finally the muscles of hand has been completed. Now we'll continue with the nerves in our next videos, guys. Follow all the videos in the same sequence. All the best. Done.